What is the immune system's link to neurological disorders? Imagine your body's defense team suddenly turning against your own nerves. That's what can happen in some neurological disorders. The immune system is designed to protect us from infections, but sometimes it gets confused. It can mistakenly attack the brain, spinal cord, or nerve fibers, leading to serious health issues. This connection has become a major focus in medical research, especially with recent advances in immunology and technology. In many cases, the immune system produces autoantibodies, proteins that target your own nerve tissues. For example, in multiple sclerosis, the immune system attacks the protective covering of nerve fibers called myelin. When myelin is damaged, nerve signals slow down or stop, causing symptoms like muscle weakness, numbness, or vision problems. This autoimmune attack is a key part of how multiple sclerosis develops. Another way the immune system affects the nervous system involves T cells, which are immune cells that help fight infections. Sometimes, these T cells releases chemicals called cytokines that cause inflammation. When inflammation occurs in the brain or spinal cord, it can damage neurons and supporting cells. This process is seen in conditions like neuromyelitis optica, where immune activity causes inflammation and vision loss. Molecular mimicry is another factor. It happens when the immune system confuses nerve tissue with germs or viruses because they look similar. This confusion can trigger autoimmune responses, as seen in Guillain-Barré syndrome, where the immune system attacks peripheral nerves, leading to weakness and paralysis. The blood-brain barrier acts as a shield that keeps harmful substances out of the brain. But immune activity can weaken this barrier, allowing immune cells and antibodies to enter the central nervous system. This breach can cause ongoing inflammation and nerve damage, worsening symptoms over time. Scientists have made huge progress in understanding how immune responses contribute to neurological diseases. They discovered immune cells called Microglia in the brain, which play roles in inflammation and repair. Treatments that reduce inflammation, like certain immune-suppressing drugs, have been linked to lower risks of neurodegenerative diseases such as Alzheimer's disease. Recent research has identified autoantibodies targeting specific proteins in the central nervous system. This has improved diagnosis and led to new treatments for diseases like autoimmune encephalitis and autoimmune epilepsies. These conditions were once misunderstood or misdiagnosed as psychiatric or degenerative disorders. In acute injuries like traumatic brain injury, immune cells can help clear damaged tissue and support healing. But if the immune response is too strong or lasts too long, it can cause more damage. Factors like age and gender influence how the immune system reacts, making treatment more complex. Understanding the immune system's role in neurological disorders has shifted how doctors approach these diseases. Instead of only focusing on nerve degeneration or infection, they now consider immune dysfunction as a key factor. This has led to new therapies aimed at calming immune responses, protecting nerve tissue, and improving patient health. So, the link between the immune system and neurological disorders is clear. It involves immune attacks, inflammation, and immune cell activity within the nervous system. Advances in immunology and technology continue to open new doors for better diagnosis and treatment, giving hope to many patients.